871 in medic 6. You're seeing a 74-year-old male, shortness of breath.
Burns are more than simple injuries to the skin. They are very complex emergencies that require specialized knowledge and unique interventions. Besides damaging the structure of the skin and its functions, burn injuries can dramatically impact other body systems. Temperature regulation, fluid and chemical balance, and circulatory and respiratory functions are all at risk. Burns also cause emotional and psychological problems that could last a lifetime.
My face hurts. Ow.
Hi, ma'am. My name is Martin. This is Sam. We're with the fire department. We're going to take a look at you and help you out. What's your name?
Sarah.
Sarah? Okay. 871 dispatch. Dispatch next available medic unit to Rob Park. We have a burn patient, needs airway management and pain management.
Sarah, I'm going to give you some oxygen, okay? Can you pad her face with this? Take your hat off, all right? A little bit. One of these on either
Okay.
side.
It's gonna hurt.
Sarah, slide these in between all your fingers.
Okay, we got a medic coming soon. He's gonna help you with the pain. We'll give you give you an IV, give you some drugs for that pain.
Wrap this around your hand, Sarah, okay?
That hurt. This hurts. My face hurts.
Hey, Martin, what do you got? Hi, George. This is Sarah. She's 21 years old. She was barbecuing, got caught in a flash, got burned.
We're gonna need to start an IV and do some medications. So if you guys wanna head on down to the burn center, we'll meet you there in a few minutes behind you, okay?
All right, maybe I can get a map from you.
Sure, we've got one up front. We'll make sure you get that.
There.
To provide the best and most appropriate treatment, it is necessary to understand the function and structure of the skin. Skin is a barrier against infection and provides protection from bacteria. It insulates and protects underlying body structures and organs. The skin regulates body temperature, helps eliminate body wastes, and it contains fluids necessary for other body systems. All of these functions can be impaired or destroyed depending on the severity and depth of the burn. There are three basic layers to the skin: the epidermis, dermis, and the subcutaneous layer. The epidermis is a tough protective outer layer that consists of three specialized cells: melanocytes that create pigment, keratinocytes that create nails, and Langerhans, cells that protect the body against infection. The second layer, the dermis, nourishes the epidermis from beneath and is made up of blood vessels, nerve endings, and connective tissue. The third layer is the subcutaneous tissue. It is made up of connective tissue, blood vessels, and cells that store fat. It conserves heat and protects the body from trauma by acting as a shock absorber.
There's actually three categories now of burn depth. It used to be the old first, second, third, and even fourth degree burns. Now we use superficial, partial thickness, and full thickness. Superficial burn is like a sunburn or when you touch the stove. You have redness, it hurts, but not a big deal. Usually nothing you have to worry about. Superficial burns involve only the outer layer of the skin and produce red skin color with some pain. A second degree burn is now called a partial thickness burn, and that is actually more descriptive and more accurate. A partial thickness burn will involve the epidermis or the top layer and part of the dermis, which has the blood vessels, the nerves, things like that. Partial thickness burns involve two layers of skin and produce intense pain. The
The surface will be modeled white to red with or without blisters.
When you have a full thickness burn, you're talking about the epidermis and the dermis and perhaps even into the subcutaneous layer. So those are very severe burns. And in fact, as little as a 5% full thickness burn may be a requirement to go to the burn unit rather than the local trauma center.
Full thickness burns present as dry and leathery, unless it is a steam burn, which will appear white and moist. Nerve endings are totally damaged. These burns are sometimes described as insensate. The burn area is no longer sensitive to touch. However, there will still be a lot of pain due to surrounding partial tissue damage and from swelling due to the accumulation of fluid.
Burns are very devastating injuries, and sometimes people think, well, if I have a full thickness burn, there really isn't any pain. If someone has a full thickness burn over their entire body, they're not alive. So there is going to be some partial thickness burns, and those are very, very painful. It is so important to get IV access for these patients and give them IV medications. The reason you want to go with IV medications is it's absorbed faster and it's absorbed more thoroughly. Because they already have damaged tissue, to give it IM or intramuscularly may not work. So IV pain medication is the way to go. And you want to be generous with it because these injuries are extremely painful, and usually these patients are conscious. So they'll be very grateful for any relief you can give them.
When assessing a burn patient, the mechanism of injury is very important. It can give you clues to other possible complications. This information will also help the hospital better prepare for the patient's arrival, or it may indicate transport to a specialized burn center. There are several main sources of burns: thermal, chemical, and electrical. Thermal burns are the most common type of burn and can be caused by fire, steam, or contact with a hot surface.
Well, like any other patient, whenever you assess any type of patient, the airway, breathing, and circulation is first. With a burn patient, you want to get some information, both visual clues as well as part of the sample history. For example, were they in an enclosed space? If they were in an enclosed space, then you're going to think of inhalation injuries and more urgent and also more severe airway problems. And there's things you would look for, like carbonaceous sputum. In other words, you've got black stuff, in the nose and in the mouth. Also, singed nose hairs, black around the nose and the mouth. And also hoarseness, if they're still conscious. If they have a hoarseness, that's an indicator of a possible airway problem. So that's something that needs to be acted on very quickly, because superheated air will cause airway swelling. It needs to be managed very aggressively and very quickly.
Other signs of inhalation injuries include facial burns and any obvious respiratory difficulties. A key indicator for intubation is an altered level of consciousness or lack of consciousness. If an airway injury is indicated, patients should be intubated quickly before swelling occurs and the airway becomes compromised. An alert and oriented patient with no respiratory distress and no visible airway injury is unlikely to need intubation.
When you're looking at assessing a burn patient, it's like any other patient. The first thing you're going to do, of course, is assess the scene. Is it safe for us to go in there and take care of the patient? Remember, a patient is not a patient until they're removed from the unsafe environment. You're going to look and see if you need additional resources.
Following extrication and using BSI precautions and personal protective equipment, emergency care for burns includes a rapid primary survey, an assessment of the ABCs, and immediately correcting any problems. Administer oxygen and support respirations as needed. Remove jewelry or constricting clothing. Swelling can develop rapidly. Remove clothing from burned areas unless it is sticking to the skin. Cool skin with saline or clean water. Once the burn has been cooled, cover the area with a dry, sterile dressing or sheets to reduce the risk of hypothermia.
The way you treat a burn is still controversial today, and a lot of it will determine on the physician that's running the burn unit where your hospital is. Most places right now like to go with the dry, sterile dressings. They used to go with the wet dressings. The problem with that is the hypothermia. When you lose the integrity of your skin, you can no longer control your body temperature.
Yeah, Gunner Snear,
After more life-threatening issues have been addressed, assess the extent and depth of the burn injury. Contact the hospital with your findings and transport per local protocols. And remember, throughout all of your assessment and treatment, it is vitally important to provide constant reassurance to your patient.
Reassurance with burn patients is very, very important. These tend to be very painful, very disfiguring, very traumatic injuries. And you want to reassure them. Don't say you're going to be okay because you don't know that, but offer them reassurance. I'm here to take care of you. I'll make you as comfortable as I can. I'll do everything I can to help you. You want to treat these people the way you want to be treated or the way your family would be treated.
Okay, Sarah, what I'm going to do, as I explained earlier, is start an IV and get a blood sample for you.
ALS care includes airway management, starting an IV for fluid resuscitation and pain management. For severe burns, aggressive pain management is necessary. Administer per local protocols. Continuously reassess and monitor vitals en route to the receiving hospital. The physiological response to pain and pain medications can affect breathing, heart rate, and oxygen demands.
Infection is a big problem with burns for several reasons. When you think about the function of the skin, it does several things, some of them being it gives you form and shape. It's a protective barrier, so it helps hold moisture in. But the other thing is it helps you with your thermal regulation. In other words, your ability to maintain body temperature. So whenever you have a break in the skin for any reason, you're going to be more prone to infection. Now, a burn is devastating enough, but when you've lost these functions of the skin, then you're also going to be more prone to infection. And we as EMS providers have to be very careful not to make a bad situation worse. For example, when you're looking to start an IV, you should always be careful, but you want to really maintain aseptic technique, even sterile technique if you can. They're already compromised, and you want to give them every bit of protection that you can.
2 life-threatening problems can result from serious burns. Fluids that seep from the burn injuries contain proteins and electrolytes. This fluid loss can cause dehydration and electrolyte imbalances, which will lead to kidney failure and circulatory shock. In order to reduce morbidity and mortality of burn patients, fluid therapy should begin as soon as possible. Fluid replacement strategies are based on the patient's weight and the percentage of the body surface area burned. The BSA can be estimated by using the rule of 9s. The adult's body is divided into 11 areas. Each area accounts for 9% of the total body surface. 9% for each arm, the chest, the abdomen, upper back, lower back, the front of each leg, the back of each leg, and the head. The genitals are the remaining 1%. For infants and children, the rule of 9s is somewhat different, with consideration to weight and proportions.
If you measure the palm of the patient's hand, that's 1% body surface area for that patient. And that's a really quick, easy way to determine the extent of a burn on a patient.
Consider these 5 factors when determining the severity of a burn. The first 2 are critical. What is the depth of the burn? The extent of the burn? The other 3 factors are any critical areas involved? Are there any pre-existing medical conditions? Is the patient younger than 5 or older than 55?
I think one of the more important tricks of the trade is understanding which patients need to go directly to the burn unit rather than going to the closest medical facility or even the closest trauma center. The American Burn Association has criteria just for this purpose. For example, patients with chronic medical problems, even though they may not have a really large burn, they're going to be more difficult to handle. So that's one type of patient that should go directly to the burn unit.
Follow your system's protocols regarding the transport criteria for burn patients in your area. When treating burns, remember, these injuries are extremely painful and involve much more than just the skin. Your reassurance, careful assessment, and prompt appropriate treatment is critical for the best possible outcome.